Health Information, how can I help you?
My name is Davor Orec. I'm a Health Information Analyst here at Providence Portland Medical Center in the Health Information Management Department, also known as Medical Records. What we do here is we obtain and get the hospital records, we process them, get them ready for scanning, and we help out the public obtain a copy of their health information or medical records, either for themselves or lawyers or insurance companies or the doctor. And that's pretty much what our work is based on. These records over here are from our storage. They come in packed like this to protect the confidentiality of the patient. These are some of the records that yesterday I've ordered. And so since these were very old records, these are the ones that we have not been able to scan in so far, because all of our scanning starts from 98 up to now, and these are before 1998. Now what I'm going to do, I'll go ahead and look through these records to find what I need. So I found that, and then I'll go make a copy of it so I can go ahead and fax it to them, because they need a part of this record to treat the patient. And then I usually start logging into my computer, just because people might start calling, either an emergency room or a doctor's office might call from out of state. They usually tend to call very early in the morning.
Health Information, how can I help you?
Our mail usually comes in about 7:20, 7:30. They bring on most of the requests for records. So this is a central location for releases for the Portland area hospitals. So anything that people process, they'll put them up in a bag, and different colors stand for pretty much different facilities. All the blue bags, they come from the medical records department. The other colors that you see there, they're from different outpatient facilities. They'll lock them up. We come here, we have these keys. We just unlock them, take the stuff. We stamp all the mail, so that way we could make sure that all the requests that come in the mail, they get processed in a timely manner. Okay, so right now what I'm doing is we collect daily stats, so we know how many records we get each day for every different patient type. And since we keep those stats, I'm pretty much the source of those statistics. So I usually go ahead and count how many, put them in a computer. We usually do this before 8 o'clock. These are all the hospital records that our night shift staff has received overnight. We will go ahead and take a look and see what has not been received so far in the department, and whatever is still missing or has not been obtained from the units, we will go ahead and get those records. So I'm going to first start over here. These are our inpatient records that have not been brought down, and we'll go ahead and use these lists so we know what records and what floors we need to go and get. So I'm going to go ahead and make a copy of these lists for myself, so I know what I'm going to be looking for. And normally I don't really have a lot of records to look for. For example, from yesterday we had 60 people discharged, and all I have to look for is 13. So I already know kind of where I need to go. So we're just going to go up there, get what we need to get, and move on to another floor if we need to. All right. The favorite part of this job, I would definitely have to say, is that every day is challengeful. So it kind of seems like you're just getting the records, but really there's a challenge to it, because sometimes I can't find something, so I'll just go ahead and pretty much, that's my mission, finding those records so I can get them scanned in. So I'm just gonna go one by one, look up the patient's name, find them on my list here, and I'm just gonna cross them out. So that's perfect. I got everything I need. All the stuff that I picked up from upstairs, I'm just gonna go ahead and check them all off, so that way we know that they've been picked up. And I combine them with records that have been already brought down by the night shift staff. So I'm just gonna go ahead and
add blankets on top, just in case of bad weather, in case someone spills coffee or water above these, because they have a little gap here in between, so it doesn't destroy the records. We have about till 11:30 a.m. to get all that done, because at 11:30 a.m. our couriers come in and they will take these steps to our scanning facility that will use the scanning machines to put them into our system. And rest of the day it's pretty much answer the phones, help out the public that want to get their records. Otherwise, you just go ahead and see what else needs to be done or finished up, and answer our emails. And that's pretty much how the everyday goes in the medical records department. Probably the most important part of this job is to realize that the work that you do, it impacts patients. And always know that the faster you get the records, the better it improves patient care. On our part, it makes us feel good that we're able to help